Welcome to Fast Living, Slow Aging, where we talk to the experts on slowing the aging process. With me I have Dr. John Levin, who's an expert on age management medicine. So John, what brought you into age management medicine?
It was an accident really, about 16 years ago. Two well-known doctors in Melbourne suggested I cancel a holiday and have a heart operation. And 16 years later I still haven't had it operated on.
Oh my God, so you did some research?
I did some research and I took some nutrients that were suggested and they worked.
Okay, so tell us about what nutrients were they?
The main one then was coenzyme Q10. And of course, when I suggested that that's what I was going to try, the cardiologists, they laughed. And they had no confidence that it would work at all. But about 5 years ago, I discovered that the Alfred Hospital now, with the patients going for cardiac surgery, all take coenzyme Q10. I think it's 300 milligrams they take for a month before the surgery.
Oh, okay.
But that was only one of the nutrients I took then. I took some other nutrients as well.
And what were they?
Alpha-lipoic acid and L-carnitine. They were the main ones.
So what did this cocktail do?
Well, one of the things that happens when you age is that the cell walls do not let the nutrients through in sufficient quantity. Now, every cell's got little dots, if you look under a microscope, called mitochondria. They're the engine of a cell. All the energy that a cell requires comes from those dots. But like any engine needs fuel. And those three nutrients that I just told you about, they're the fuel. When my patients now take those three nutrients, they seem to have much more energy.
Okay, so they have a marked energy boost, do they?
Well, they do, because the cells don't get enough, because the cell walls are not letting them through in sufficient quantity. Now, mitochondrial decay, most doctors haven't heard of it. Although the Baker Institute in Melbourne are doing some research. There's Oakland Children's Hospital in California doing a lot of research on it. There's a lot of research all around the world.
Yeah, we've got one of the leading researchers in Australia, in Melbourne, Tony Linane. So, okay, so with your patients, do you have a set methodology that you work with?
Yes.
When you see them?
Yes. I take a history. I take a very long history. Probably would last nearly an hour. And when I was a medical student many years ago, I remember our lecturers at the time were telling us that a history was more important than anything. From a history, you can really get a clue as to what the problem is.
And what does it involve? What kinds of questions?
Well, the usual questions that that most doctors do, although I had a psychological history as well, because some of the things that happen as you get older, things like fatigue, weakness of the muscles, put on fat around the abdomen, but also social things that happen, especially if they're low in growth hormone.
Okay, so there's a growth hormone levels cause the social.
Well, no, what you find is that a lot of patients. I'll give you an example. A patient goes to a general practitioner, and the general practitioner says, "You're fine, Mr. X. Your blood pressure's normal, your cholesterol's normal, you're not overweight, you don't smoke, you're a very healthy person." And then they come to me and they say, "This is what the general practitioner said, and he wanted to put me on a antidepressant because I told him I just don't feel right." But what I find with not all these patients, but quite a few, they have low growth hormone. And there's been a lot of research being done in the UK, in the United States, that shows that people that have these symptoms and have low growth hormone, if you give them a little growth hormone, not much, just a little bit, they seem to improve dramatically. Not just a little bit, but dramatically. Their whole life changes.
Would they become more vital again? And
they get all the energy and back again, and zest for life, and just changes them completely. Now, it doesn't happen with everybody. I mean, it happens. It's worth trying, only if they're low on growth hormone. If they've got a normal growth hormone, you wouldn't do it. But if they're low on growth hormone, they've got these symptoms, you try it. It's better to do that can give her an antidepressant, which of course has lots of side effects, especially in men, because they then have trouble getting erections, so forth.
Right, which makes things worse, counterproductive.
That's right.
So what would be a typical patient that you see? What's their age and circumstances?
They vary between 40 and 70, and they come from all walks of life. I have lots of patients that are doctors, I have patients, all sorts of patients, businessmen, people that work on ordinary jobs. So I have just a whole range of patients. I have about 1 in 4 is a woman.
Okay. So in terms of growth hormone, have you found that the response to growth hormone is different with women than it is with men?
No, I haven't found a difference.
Right. Because with growth hormone, women have to take slightly more, don't they, than men?
No. The only difference with the hormones is with DHEA.
Okay.
DHEA, I think women need less than men.
Yep, okay.
Not with growth hormone.
Oh, right, that's interesting.
And then a lot of men, their libido's down, and it seems to help them.
Yep.
And with women too. I mean, my patients come and tell me that I've changed their lives for them.
Which is fantastic. So what about in terms of ongoing monitoring of patients? How often would you typically see your patients?
Well, when they go on, I see them maybe once a month for the first few months. I monitor the level. Now, if they don't improve, then I don't give them the growth hormone anymore. There's no point.
Okay. So what other areas do you address? So it's mainly nutrition and looking at hormone levels?
Things I concentrate on smoking.
Right.
If they smoke, I will not take them on as a patient.
Right, yes.
Overweight, they have to lose weight. If they're too obese, I'd send them away to the general practitioner and see if he can do something with them and come back. But there's no point in taking all these things because they're not cheap, they're expensive. And if they smoke or they're overweight, it's counterproductive. I mean, they're wasting their money. They need to exercise and they need to eat properly. And concentrate more on low carbohydrate and high protein diets.
Okay. And you find that most of the patients, they're pretty motivated then
to do this, to practice to comply, this is a good word, they have to be motivated because they've got to take a lot of things. And one of the things I do is if I tell them to take something, I give them something to read about why they're taking it.
Yes.
Now, whether it's DHEA or alpha-lipoic acid or all this, I give them a page or two to read. Because if you don't do that, they'll take it for a month or two and then they'll stop it. They don't know why they're doing it. Yeah. And it's very important that they know why.
Okay. Thanks, John, for coming today.
You're welcome.
This is Fast Living Slow Aging, where we talk to the experts about slowing the aging process.